Okay, so this is the treatment room, one of the 2 treatment rooms that I'll use when I'm working. And so this is the desk where I would sit and conduct my exam or my history if I'm doing a consult and when I'm seeing the patient. And then these are the carts that we have set up so that everything is within hand's reach, so that when I'm actually doing the injection, I'm sitting on the stool here, and there's the big garbage can that I can throw everything into. I've got a sharps container for the needles, and then below that I've got a container where I put the expired bottles of freezing, so that gets emptied periodically by the nurse. I've got my glove size sitting next to the syringes, and then additional glove sizes below for people on other days if they have a different hand size. This door over here is the one I told you, that one's blocked off because we don't use it. And here's our storage cupboard that I open up just to show you that we have the excess freezing, of course the bupivacaine, and then the carbocaine that you guys don't have yet. Okay, we do have some Marcaine with epi, which basically never gets used, or Depomedrol, and then some of the resuscitation drugs. And then of course I keep all the needles and everything else over here. And here you see the smaller needles here, the ones that I told you about that you guys don't have, the 3/4 inch 30 gauge that you guys need to get some of. And I have some spinal needles for patients that are morbidly obese, where I'm trying to do pudendal and sciatic nerve blocks. Okay, so everything that I need is on this tray. Okay, and then of course on the other side is the stepping stool for patients to come up and sit down. Little table in the corner, and here's a Mayo stand if any of the guys that are doing epidural procedures require that. So this is how an ideal room should be set up. And notice how there's none of my own personal office crap in here. We have another office that the 2 of us share when we're here doing work. So we have other treatment rooms down the hall, and here's the office in the corner that Kevin and I will share on a day when we're both there. There's an actual colleague, Kevin Green. This is for the docs in Ottawa.
Hello, how are you?
So this is how we have it set up here, and I think it's a better scenario, and one that we may have to look to rejig for you guys to improve some efficiency. Okay.